Why not? Hi, Miss Hampson.
Morning, guys.
How's it going?
Oh, it's going. Just got out of the shower. You guys have a final today?
Nope, just 2 tomorrow and 1 on Thursday.
Okay.
So, yeah.
Okay. We'll wait to see how many other people join too. So you guys those who contributed, most everybody did, to the study guide, did have a lot of information, a good review, a lot of points. That was one way to add to review with PowerPoints and the activities we did to go in. So what I want to do with all of those materials is for today is to what are some things that we can go over as a group that you just didn't understand. We can take time to go through the study guide. There's a lot of good information that you're going to need to know on there. What I can't do is go over just what's on the final and what's going to be in the final. What do I just need to know? And I understand that's what a lot of you are. I mean, I would want that too if I was a student, but we have to get the knowledge out so that you can take all of the knowledge so you know how to choose the correct answer and go through that too. So I did talk with Dr. Chenard too and Ms. E, that for those of you, which some of you have let me know that you want to go back and review some of the missed test questions that you had. So I am willing and did volunteer to go through with that, because for us to go back to unit 1, 2, 3, 4, 5, 6, 7, 8, 7 and go back to all of the questions that were missed at this point is not going to come to fruition.
Miss Hampton?
Yes.
Hi, good morning. It's Jennifer. How are you?
I see your name. Hi.
You can't see me. I'm laying in bed. But I was going to ask, the only reason I'm asking is because Miss E, before our final, she'd always, and everybody can vouch for this, but she'd always sit us down in class and we'd finally be able to go over every test, because she'd either go over them after, but then we never were able to because somebody was always missing from class. So then what she did for our final is she literally went over every test question, asked us, didn't give us any answers, but made us critically think about what the answer was, why we could have got it wrong. And to be honest, we wouldn't have to go over unit 3, 6, or 7 because you gave us study guides for those, and I think everybody did pretty good on those exams. I think we'd only have to go over 1, 2, 4, and 5. I was calculating it last night because those are the only ones we had no guidance in, and those are the ones I personally did the worst on. And I still don't know, like, the thing is like, I can't learn from what I got wrong if I don't know what I got wrong. And that's why I was emailing you and Miss E all night, but nobody ever responded.
We got one response at 1:15 in the morning. What the plan is for me today is knowing that by the time we got to units 6 and 7, people were comfortable, and we did have some guides. In units 1 and 2 and 3 is correct with most students, and some students didn't do well. Many students did do well, did do fine on the tests. So what I wanted to do is, what I did is I looked at all of the statistics from units 1 and units 2 exam, and I went through and looked at questions that most people got wrong. So that's where I wanted to focus today, was on units 1 and 2 3, anything else that people have questions on. And that what I was going to offer is for those who want to go through missed test questions, we can do that. I can only do it verbally because we can't have any video, any technology, anything of that nature
Oh yeah.
to go through that. And that's for everybody. That's not just answering what Jen was asking. That's what the plan was for today. I
Awesome.
have down for students who have let me know that they want to review questions. I've got Hyatt and Jenna and Jennifer Harris, Nina, and Amber. So if there are people who want to review any of the test questions too, I will give you my phone number and then I can review them with you verbally and scan through some tests. And we can do that today.
So
Okay,
you can add me to that list. I would like to do that, Ms. Sampson.
Okay.
Thank you.
All right. So from my review, let's go through unit 1. I want to hear questions that you have regarding unit 1.
And my Leah said that she can't join right now, but she was wondering if you could post a review later.
Oh yeah, I'll post it to the public so everybody can get a chance to look at it too. So if you go back to unit 1, unit 1 was introduction crash course to the class. So typically on units 1 and 2 is where students didn't do poorly. They did worse on the exams than our later exams. So I wrote down a few good points to go back to is to know Black's classifications for restorations. So what's class 1?
Pit and fissure.
And pit and fissures can be in the occlusal surfaces and what other teeth?
And the buccal or the lingual.
7 and 10. Like 7 and 10 lingual. You'll see that. Okay, what's class 2?
Anteriors.
MO.
And
Posterior.
Yep, posterior and the interproximal. Class 3?
Interproximal anteriors.
Yep, interproximal on the anteriors. Now what's 4?
Including incisal edge.
Yep, that's with the incisal edge if something was left untreated and it decayed into the incisal edge. Class 5?
Hips.
Gum line. And then this is still a classification, but it was added later on. So what is a class 6?
On occlusal cusp.
That's that cusp tip incisal edge due to the wear, erosion, grinding that we've seen more of in the last 20, 30 years. So they added that. Okay. Base or liner, what one offers thermal protection?
Base.
Base. So understand the difference between base and the liners. So there's a lot of chemistry in units 1 and 2. I'll narrow it down for you, and there was good review for understanding the different bonds. It is good to understand the difference between a plastic bond, a metal bond, composites, knowing it's 2 or more materials, and a ceramic bond. There was also discussion on the permanent dipole and fluctuating dipoles as far as how the electrons are pulling back and forth together. Permanent dipole, what is meant by that? These are going to be the deep questions from units 1 and 2 that did not go over well the first time. So if something has the permanent dipole, it's pulling the electron. It doesn't want to give it back. It's making it stronger versus the fluctuating dipoles. It's an uneven distribution of electrons. That on page 27 is a good review to go through and look through that versus just copying and taking notes for right now.
Can you repeat? You said the difference between plastic, metal, composite, which is 2 or more.
Yep, so
What was the last-
plastics are covalently repeating bonds. Colloids, we know that from our hydrocolloid and our impression material, that's 2 phases. So that's our jello example. And a covalent bond just means that there's 2 atoms sharing electrons. There's also hydrogen bonds and metallic bonds that if you refer back to like page 25, 26, 27 is going to be a nice review for you on that. What does it mean when something changes in volume due to temperature? We spent some time on that, and that's good to know.
Is that the coefficient thermal expansion?
Good job. So that's like the balloon. We have it blown up, goes outside, it's cold, and the volume lowers because of the temperature. So good, Nina. It's good to understand the coefficient of thermal expansion. This unit discussed the different tensile strengths as well and the types of stress. So I wanted to spend some time going over the strain, pushing, crushing, elasticity of the different types of stress that are out there. Pulling, what type of stress is pulling? You're working out and you're, I'm not really working out, but if I would, I'd look like this if I was doing my biceps.
Is that compression?
Compression, we're going to be having it being more squeezed together like this. If I'm pulling, it's tension. I'm pulling on that tension. If I'm compressed, I'm pushing and squishing and crushing it together. What about shear?
That's like sliding.
Yeah, just think of your kitchen shears. It's a scissor. It's sliding.
So was the answer shear?
Shear.
Okay.
Yep. So sometimes we have combinations of compression and tension and shear. What does that force? Kind of like what you'd have to do to an ortho wire in order to get it going. It is compression, there's tension, but you're having to move it all around.
Is that bending?
Bending.
So shear is bending? Or no?
Shear is a sliding force. Bending has compression and tension and shear. So it's all 3. And if something is in torsion, like we know a torso-verted tooth, what does that mean?
It's rotated?
It's rotated or twisted. Who remembers what creep is?
Isn't
Isn't
that?
it this?
Besides the song
Go
and
ahead.
Ms. E's dance.
Go ahead, Maria.
Isn't it like a slow change in shape?
When an object is under pressure like that, it's gonna creep. That's what it is, small change in shape that results when an object is under continuous pressure. So in there, it also discusses being something versus tough versus hard. If it's tough, what does that mean? Versus hard. Let's think
Well,
of
one of them has to do with like we talked about like the scratching of it or like
Mhm.
I think is that
Resistant?
tough?
So if something's resistant to scratching, would you say it's hard or is it tough?
I think I put tough,
Hard.
but right? Oh,
It's
okay.
hard. Tough, it can still distort, has ability to distort but not fracture. Versus if it's hard, it has the ability to resist scratching and indentation.
Think about like diamonds being one of the hardest, whatever, and so they can scratch glass, but they
I-
don't do it themselves.
I can't really hear you, Amanda.
Oh, sorry, I forgot I had my here.
I think you're sharing an analogy with diamonds on a burr versus enamel.
Right, yeah. So like you can scratch a mirror with a diamond, so you can see that, and the diamond doesn't change shape. So that would be harder than the glass.
There you go. And enamel is the toughest surface on earth as of date, and that's why they put diamonds on the burrs in order to cut through the enamel. Okay. Any more questions that you guys want to discuss? Anything with units 1 and 2? And we'll go into sealants too. Sealants you guys did pretty well on, but some people did have some issues on the exams. So I'm going to go through that too.
I was gonna say, honestly, I don't remember any of the questions from any of the exams. So I wouldn't know what to go through.
Well, I don't expect people to remember all of questions that are on the exams. You will see some questions. You might see some new questions for review, but it's randomly pulled from previous information and exams. So some, so we're going over the ones that most people missed now. Sealants. What causes a sealant to fail?
Moisture.
Moisture.
Moisture's bad because it contaminates it. So I think we've had that question multiple times, isn't it? Like moisture, wetness is bad for all dental things. So why do we do sealant?
Preventative measure?
Yep. Because we
People
don't want our patients to what?
To get any caries?
So what type of patients? I'm thinking we don't want caries, but patients who have an elevated risk for caries are good candidates for sealants. What are a couple other good candidates for sealants?
Deep
Children?
pits and fissures.
Yep, kids with deep pits and fissures or anybody with deep pits and fissures. And according to the book, can you put a sealant if there is an incipient?
No.
So that is different. Usually if there is an incipient, some of the fluoride materials or some of the sealant materials with fluoride may reverse that. If it's an incipient, it has a chance of going healthy. Typically when that's done, it usually leads into decay. But why we do the sealants is because patients have an elevated caries risk, deep pits and fissures. And we can, if they have an incipient, on pit and fissure sealants. So according to our book, those 3 things would be why we do a sealant.
So
Everybody,
just for clarification, if we're in like a dental office, if the
Mhm.
dentist says, yeah, this is okay, even though there might be a tiny bit of decay detected, it's still okay to do the sealant.
yes,
Well,
but
that
an incipient is, it's just still into the enamel. It has a chance to stop. So it could be stopped by cleaning it out very minimally with our brush and acid etching it, and then putting a fluoride releasing material in there. It isn't penetrated through the next layer of the tooth or the dentin. So there's still a chance. Worst case scenario, it comes out and they'll have to have a preventative resin or a composite. So is there ever a case when we wouldn't use our brush and pumice to prep for a sealant? There's one little blurb in the book on this, and this is going back for a review to all of you here, which many people missed this question on their exam. Because we would think, yes, that's part of our procedure. We always do our brush and our pumice, and that's our step. But there's a little blurb in there that states that for some patients who have optimal plaque control and nothing's there, like maybe this is your adult patient coming back for a sealant, that we wouldn't need to pumice their teeth. We always do the edge, but we wouldn't need to pumice their teeth. Following protocol, how we do this at Herzing in lab is we're going to polish. We're typically going to see those kids and have patients with plaque on there. However, if you have a patient with optimum plaque control and there's nothing there and things look good, we would proceed to the acid etch. Questions?
Do you know what page this is in the book on?
Out of how many hundreds and hundreds of pages? Come on. It's in the sealant chapter.
I'll look for it.
How do we know we did a good sealant? What are the steps that we take to make sure that we have a good sealant in place?
Feel on it and pull around on it with our Explorer or Shepherd's hook.
Yep, we're going to use an Explorer to check it.
Let the patient bite.
Yep, patients can bite down and tell us if it's high and using our articulating paper. How else? We can see that it might not be good. Sometimes we can see that it's too high. We'll see it marked with our patients. So we're going to visually look at it. And when we're checking with it for our Explorer, what are we trying to do? What are we checking for?
Tackiness or trying to pull it out.
Yeah. So for us to know if we're going to see a good sealant is we're going to visually look at it. We can ask patients' opinion on that. We're going to try to dislodge it using an Explorer in there. And what else do we need to do to check to make sure, let's say, sealant didn't get stuck where it shouldn't be?
Us.
Yeah. So we are going to floss to check in there. So those would be the things that we would do at a sealant appointment. And when somebody comes for a sealant appointment, that's their appointment. We aren't looking for, obviously, if it's been more than 3 months, we're going to have another examination for making sure that there's not cavities, but we're not going to go into our whole appointment, such as checking pocket depths and EO-IO and the whole thing. Sealant appointment is a sealant appointment. Make sense? Okay. When we're using the Explorer and we're checking, there are things that we do not want to see. What are things we do not want to see on our nicely newly done sealant? Similar to things we don't want in our impressions either.
Voids.
Yeah, any sort of
So
bubbles.
keep coming. Yep, voids, bubbles. They're not really blebs on our sealants, but we've got voids, bubbles, and what if what's another word for it's a little extra went over, whether you're doing a composite, an amalgam, or a sealant.
A flash.
The flash is not good in dental. So we're checking for bubbles and voids and any extra flash that we have to go back to. So that was unit 1 in a nutshell on important points that I want you to go back for to understand. And unit 2 is another big one as far as chemicals and chemistry and such. And as dental hygienists, we didn't go to school to learn about all the chemistry and the physics and all of this jazz, which is why units 1 and 2 are typically a little bit more challenging. And the further we get into things that we actually want to do or know about, it gets a little easier to understand. But these little basic informations helps us understand why certain materials are chosen and information behind it. So we have to go through it. So let's narrow in on unit 2. So we talked about expansion and amalgams. And what does amalgam mean as far as an amalgamation of metals?
A mixture of metals?
It's got a lot of different metals in it. So there is a metal that's in there that causes expansion. Do you remember which metal causes expansion? Which would lead to pore condensation, which leads to open margins, and then we have to replace our amalgam.
I really want to say zinc.
I really want you to try again.
Aluminum.
Try
No.
again.
Silver?
It's silver, and pretty
Wow.
much I think all but 2 students missed this on a previous exam. So silver in amalgam causes expansion. So just review that property in unit 2. So if we have an amalgam that looks icky, but not icky enough that we want to get a new one, what are we going to do? What technique did we learn?
Polish.
Right. So we have our amalgam finishing with our finishing burr. Does that mean it's a start or an end?
Start.
That's the start. So our amalgam finishing portion is that we're using that burr to take down tarnished, corroded little pits in our amalgam. When we move to the amalgam polishing step, then what do we do? Start.
We use the brownie from coarse to the least coarse.
Yep. So we're doing the brownie, the greening, the super greening. We're following that path. Good. Let's see. We talked about flash. Who remembers what the amalgamator does? If we have these amalgams, we have that capsule, and then we have to amalgamate them, mix them up together.
Triturator or tritrates.
Titrates, trituration, all that big old word, fancy word for it. That's when the process starts. That's when it's getting all mixed together. And then It'll be all mixed, it'll put on, they'll use an amalgam condenser into that prepped tooth. Let's say it was a really big one. You're gonna have a liner in it, a base. Know the liner and the base and the thermal expansion or the thermal protection in there. So the amalgam condenser, they're gonna fill it all in. You've got these pictures in your book, but then there's special tools to add the details in there and make sure that it looks like an occlusal surface that's in there. So you have to carve in your anatomy. So what are some of the tools that one would use?
I actually remember this question. I think I picked Waz Carver, but that was the wrong answer.
A lot of people
Yeah, I remember this.
did not know this question.
Yeah, there was.
Oh,
Cleoid.
yeah. So the discoid cleoid is an instrument that's going to carve into the anatomy. And if we have to get into the interproximal area, when you look at these instruments in your book, there's curves that help them get interproximally. Is the Hollenbeck carver is what's going to go interproximal. So that's a universally missed question from Unit 2. I think probably only anybody with an assistant experience got that one right.
My question, Ms. Hampson, was I remember a question on there about how high you fill it, millimeter wise.
Yep.
What was that? Was that 1 or 2 millimeters?
It was 1 millimeter.
1 millimeter. Mm-hmm.
I won't forget that.
Yep, 1 millimeter. Okay, let's see what we got here. Remembers percolation. That's a nice word.
It's something with a composite when you at the margin.
Yep, and that it goes back to old macrofill composites.
I'm
Which,
sorry, Miss Hampson, I'm sorry to interrupt you. Did you say percolation?
yep,
Okay, thank you.
you guys are probably too old to know a grandma or great grandma's percolating a coffee cup. But or coffee maker, it used to be a little glass thing on the top, and you'd see it percolate up and down, up and down, up and down, because it's heating and cooling, and then that is what expands and contracts. So the old materials with heating and cooling expanded and contracted too much, and that's why you'll see some of probably our older patients that their composite's going to be a little bit more yellowed, it's going to be a little bit more rough. You might even see a pebbled surface, and you'll see an open margin on there due to percolation. Okay. Unit 3. Specific questions about Unit 3. We kind of led into that a little bit with the bonding agents, because we have our macro mechanical and our micro mechanical. We just different preferences for different things. Most days it is microscopic. We talked about etchant and sealant, and that same etchant is typically used in dental materials as well. What's the typical percent of our phosphoric acid?
37.
Yeah, it's usually going to be 37. Yep. And what was our first bonding technique ever?
Etching.
Etching. Yeah. Yep. It's been around for a long time. So There's also in the book with it talking about the enamel tags, the hybrid layer, the smear layer. I want you to be sure that you review that so you know which layers are which. What is formed when the dentin's actually being prepared. So we talked about the wood going through, and there's water. We've got
Smear layer.
yeah, that smear layer. We've got that coating all over that we need to get out of the way. And macro fill, macro mechanical, all of that has macro in it. And then you've got micro. So which one are we going to see? And which one is going to be harder to see?
You can see macro, not micro.
Okay, so looking at the word, putting it all together, you're going to be able to figure out that part on there. For percolation, we talked about that. Surface does that occur on?
The margin. Is that what you mean?
Margins of the MO, the O, all around in there too.
Okay.
Okay. What other questions you have?
Can you just let me grab my computer if that's okay? Where I put it. One second.
I'm looking through with my notes too.
Hey, I don't know which chapter this question was in, but it was like in one of the chapters, and it asked about like, you know how if there's like a ledge on like an MO, and you have to use like an instrument to smooth it, and it's either you go under or above it. Do you remember that one?
Remember seeing that one.
I got that one wrong, so I was just curious what it was.
I believe that one is gonna go. We'll go through it. I think we need to be going under.
Okay.
So keep that. Put a pin in that. Put a boom right there, and then we're gonna be going back to that one.
Okay. So 3 was kind of about Unit 3. I remembered the most because that's the first time you made us word scramble. So that's really helpful because I kind of have that to build a study guide on. And then some stuff I found in the point, but only in the explanation, not in the actual questions or answers. So I just want to make sure for Paul, there was a question about the pulpotomy. Am I saying that right?
Pulpotomy.
Yeah, pulpotomy. And reading it, it was like, what type of crown goes on there? And is that stainless steel crown? I mean, I looked it up, and I think that's the answer because I'm pretty sure I got that one wrong because I didn't know.
A pulpotomy is a root canal in children. And so in children, we aren't going to put anything permanent on there. So that's when we're going to use a temporary crown, which is a stainless steel crown.
Okay, thank you. And then, I mean, I know there's something on the rubber dam.
Yeah.
Oh, the breaks off cleanly. There was stuff about like adhesive failure between the bonding material, fracture failure, cohesive failure within the bonding, stuff like that.
So we can go through that on for your questions that you're wondering about too.
Okay, okay, cool.
That. Yep. One thing that was a universal question is that flowable composites, they're generally, once it's packed in there and it's all condensed in there, they're usually covered with some more composite. Would it be microfill, a hybrid, or more macrofill?
Isn't that hybrid?
That's hybrid. So it's covered with hybrid.
Okay.
when you are doing restorations, especially like our veneers and crowns, our ceramental ones, which layer gives the restoration a more natural appearance?
Isn't that the like dentinal layer or something like that?
The color from our teeth comes from dentin, because our
Yeah.
enamel is clear. Yep.
Miss Hampson, I just got your email. Like it just came in, so thank you.
What email?
The email I guess you said you sent earlier. Yeah, it just clicked into
Oh,
my
yeah.
phone like just now. Yeah.
Yeah,
Sorry.
'cause I was up at 1:10 in the morning working on that, and that's when I was reviewing this for today, because I defend my
Oh.
theses in 9 days, and I had to work on a PowerPoint and do that too. So,
Oh my God. Well,
so
thank
this
you so
morning,
much.
thank you. I'm working with you, and over the weekend, even though I was working at home with you guys. Okay, so surfaces. What are implants typically made of?
Oh, like get a
Titanium.
With
Oh wait, sorry, what?
no,
Titanium.
or titanium. So we have to use special instruments with working with our implants, because if we use metal instruments, what would happen to that any hydroxyapatite and titanium on our surface?
Scratch it.
Yeah, there's going to get scratches in it, and the scratches is what attracts the plaque and the buildup and the food, and can lead to failure. And that's why some prosthodontists, periodontists, whoever put in the implant, don't want any cleaning around it, because if you clean it poorly, it can lead to failure. So we have to be very careful with that, to use our special instruments with that too. And the type of implant that we see most of today placed in it is like when it's placed in the bone, what is it called?
Endosseous.
Yep, an endosseous one in there. And let's see. Anything else to review for Unit 3?
Let's see. I know we went over periopax in Unit 3, the root fracture and the broken jaw thing. Something about, is the answer for, this has been driving me nuts, but can restore a single missing tooth? That's a bridge, right?
If you're going to restore a single missing tooth, you can do an implant there, but if you have a bridge, that would be like a 3-unit bridge.
Okay.
So you'd have a crown on the one side, then the pontic, and then you'd have the crown.
Okay. Okay. Thank you.
Okay. Let's see. If we move into Unit 4, and I don't remember who had what unit, but somebody put in a nice explanation for obtundant. What does obtundant need? And which cement would we say is obtundant? And why?
Reduces irritation and zo.
So the obtundant one.
Yep. Yep, the zinc oxide eugenol, because that eugenol was obtundant to the pulp. So we won't think about periopax yet. Now we're going to focus on zinc oxide eugenol as a cement. So cements, bases, liners. This is a good one to review. Which was the cement that is used like in ortho brackets and would because of releasing fluoride.
Glass ionomer?
That's the glass ionomer. And then somebody in their portion of the guide that when we're going to clean that glass slab and we're going to clean our what are we using to clean up our cements that we talked about that we're gonna do according to the book and how you're learning it, but we may not do it that way in practice. Water and what?
Baking soda?
Yep. So water and baking soda. And which material has to be fixed on the glass slab? Figure 8.
So
That's
Uh,
great.
Zinc phosphate.
Zinc phosphate.
Phosphate too.
Yep. Zinc phosphate. What? Zinc phosphate, don't be late. Figure 8. However you want to remember that.
I have a quick question. So, there was a question about how to clean a glass slab. I don't remember if water and baking soda was an option. I thought it said something about like washing it under water.
Who's got comments on that?
Do you remember if water and baking soda was an option for the answer? Because I don't remember that being an option.
It will be an option.
Okay, thank you.
Thank you.
It is. And then Jen, you asked like the replication of a single tooth. That yes, can be a bridge, but if you're referencing to this chapter, are you talking about the difference between the model, the cast, the die, and the study?
No, I just remember I can't I can like I said, I can barely remember, but I just remember there was a question about, and this one is in unit 3, not 4, and it was like, can you restore a single missing tooth, or how do you restore a single missing tooth? I don't know. It just drives me bonkers.
Okay, yeah, that would be the bridge, the and implant, or having some sort of partial made for that.
Okay.
What is a cast? I want to know like what's the cast, the cast, the model, the study, the die. Let's review that.
Just like a few teeth. It's more detailed.
So it's like someone is having a custom tray made, and they're having some bridge and some fancy thousands of dollars of work done to look at that too. And even more specific would be what? Single tooth.
A die.
A die.
Because you would die if you only had a single tooth. And the study models, those are going to be, you know what those are? They're going to be educational and not specific to any real dental work other than making whitening trays, that need to be specific but not as detailed as somebody getting a crown. Okay.
And then the model's kind of like the cast, right?
Yep. Well,
Okay.
it kind of can go interchangeable with that. Okay, let's see. Can glass ionomer be used as a base? Yes, and if it's used as a base, why is it used as a base?
Because it releases fluoride.
And why do we use a base?
Thermal
Insulation.
Thermal insulation.
So releasing fluoride is good too, but used as a base, we want it because it's much stronger and can be packed in there and will provide that thermal insulation in there. somebody added this and put this in the study guide too, is that when we are mixing that zinc oxide eugenol, what is the texture?
Crumbly?
Crumbly. We've got a lot of little crumbly words to be going. We've got doughy, crumbly. Let's see. You've got quite a bit of information as far as different materials and putty materials. We've talked about the agar, alginate, hydrocolloid. Know the difference on what's reversible and what's not reversible, as well as what's used in what capacity, such as we know we'll use an alginate or a plaster in models that we would be working with, or whitening. If somebody was having a final impression for something like a complete denture, or their crowns or bridges, something really fancy, what material would we use for the impression? We're going to use like an alginate, a reversible hydrocolloid, or like our addition silicones. Fancy. So this area, many people missed questions in this area, and since I'm the only one talking right now, I think that we would go back and know the different materials used that are available for taking impressions, not just alginate. Okay, let's see. We're getting into things were looking brighter by the time we got to Unit 4, and then 5, 6, and 7. So Unit 5, who's got questions regarding any specifics of Unit 5? Got a good understanding of radio opaque and radiolucent?
Yeah.
Okay, because by this time, some of these things that were a struggle earlier on make much more sense by the time you're at the end of the course. So there were, talked about tarnish and galvanic shock and corrosion, things of that nature. What's tarnish?
Tarnish is like the outmost layer of the dirt or whatever on the tooth or something like that.
That's true, but what's tarnish in fancy words?
Electrochemical attack.
It's an electrochemical attack on the surface. So yes, you're both right. But we're going to choose electrochemical on there. And remember the first question in this, some people picked chemical and some people picked electrochemical, and then we went back because the book says both, and so we had to correct it on the test. So electrochemical is the answer for that.
Okay, locked in.
Got
it. Electrochemical. So what happens if it's two dissimilar metals in a wet environment? Like anybody who's got amalgams, go put tinfoil on your amalgam.
Is it galvanation?
It's galvanic.
Yeah.
Yeah, that's the galvanic corrosion in there going on. You're going to get a galvanic shock on that.
There was a question about dental tissue, and if it was radio opaque or radiolucent. It should be radio opaque, right?
For soft tissues, up here, radiolucent, there's dark, but the pulp doesn't in there. That's in page DH204, you're gonna see that it generally, it's not going to show.
Okay, so it would usually be radio opaque.
So that's,
Right.
because it's got different layers. Radio opaque is what we're looking for, is gonna be the crowns and the hard surface and in there. So we can
Okay,
review,
oh, yeah, I mean radio, like, oh, so it would be radiolucent.
and then that we can go through that too, individually for you too, Nina, on that. This was a question. Some of these questions, you're having to pick what the best answer is from the stem of the question, and also understanding what it's asking. So this question I have reviewed with some students before. So I'm going to pick this one for a general review. That if it is, which statement is not true about cleaning instruments after patient care? And we have got to pre-soak solutions. Pre-soak solutions are to be whenever timely cleaning is not possible. Hand scrubbing is not advised due to an increased risk of splatter. Enzymatic cleaners digest blood, proteins, and other debris, and ultrasonic cleaning is necessary for visibly soiled instruments only. So which one is not true and why?
I think the hand scrubbing one, because you could hand scrub.
I see where you're going with that one.
But isn't it also like the ultrasonic? I mean, we still use it even if they're not, even if we don't see things on them.
Well, that is correct, and that's the clue, that's the kicker. So the other ones are true, and it can be done, but ultrasonic cleaning is necessary for visibly and not visibly soiled instruments. So it's not only visible. Does that make sense? Just kind of going through on what, just really thinking a question, and to really read it, go through it, make sure that if you click your answer and submit, we can't go back and change it, or many people would say, I didn't mean to have that answer, I really meant this answer. What you click is what it is. So nice and slow, double check, and make sure that you are clicking what you want to. This one also talked about gloves and what we use on what. When we're cleaning people's teeth and working, what are the gloves that we're using?
Exam gloves.
Exam gloves, because our utility gloves, we're cleaning up. Surgeon's gloves are more expensive, form-fitted, and they are sized 7, 7.5, 8. We're using small, medium, large, extra large, unsterile gloves in there. This unit also covered getting all your shots too, and benefits of that. So what are some of the shots that we need to get, and what are they and why? Starting with a flu shot.
Well, the flu is highly contagious and we can pass it to each other.
Yep. And what's the fancy word for flu?
Influenza.
And how many times in a year are we supposed to get a flu vaccine, or recommended?
Once.
Okay. All right. So we don't want to get any chicken pox or shingles or anything like that. So what type of what's the word for that, and vaccination for that?
Is that the varicella?
That's the varicella zoster. And what are our series dosages, weeks? What's our information on that?
2 doses, 4 weeks apart.
Boom, yeah. All right. So HPV, hepatitis B vaccine. What do we have to do for that?
3 doses.
That's 3 shots. Yep. First, second one, couple months apart, and then you're going to go back at 5 months and have it done. Can have your titer checked. Nowadays, they're recommending people, once you have shots, you're still going to go back for more. Sometimes with the HPV, people will have a titer level that they can have shots and it just doesn't move, doesn't register. They may just even be immune, but it's still good to go in and have your titer level checked for all of your childhood shots, measles, mumps, rubella. They're going to start recommending now that adults have that redone too.
What is it called? Sorry, it's called a what level?
I don't know about what for level.
Oh,
Oh,
I thought you said you
titer
have to have
levels. Your titer
Yeah.
levels.
Titer.
Yeah.
Oh, okay.
That shows in your blood that you have active immunization from your drugs.
Oh, that's really cool. Okay, thank you.
So what about a shot that you need every 10 years, or if you poke yourself with a rusty instrument or a rusty nail or something like that?
Tetanus.
That's your
Yeah.
tetanus one. So
I almost
that's,
called it the rabies shot.
yeah. So that's Tdap. So that one is something that we need to get every 10 years or so. That's just kind of a nice one to get just in case, especially if you're working outside or handy and I've had to get that done before. So, okay. Also know, your infection control plan, know who regulates what. There was a question on what is the goal of your infection control plan between who it prevents cross-contamination between. We've got, is it your dental care provider and the front desk lady, patients and other patients, or patients and the dental provider?
Patient and the dental provider?
Yeah. Yep. So we have reviewed this too, as well as protocol for taking our impressions. Making sure they're clean. We're rinsing blood and saliva in there. Let's see. Oh, now this is one I think everybody should get to, is when we're mixing cements, what gets forced into what?
Powder to water.
Powder into liquid.
Powder into the liquid too. Okay, this was a question that I will review because many people missed this one. It was kind of tricky. Ambient light blank, the setting reaction of light cured materials.
Doesn't it? Sorry.
Has no effect on, stops, interferes with, initiates.
Initiates?
What does other people think?
I agree with that.
Yeah, so this is something now that you've worked and done with sealants and going back, you're going to be able to use what you've learned to answer these. So it is that it initiates, it interferes with it, but that's vague. It actually would initiate that time. Everybody got 100%, and Wills for therefore on contamination of oral fluids is bad for all materials. But what about let's move to trimming and some trimming questions. We've already had a nice review on trimming the models, pouring up. You've got great guides to refer to in there. As far as importance of trimming, what do you need to take off for trimming? That's important. without me
Gloves.
giving you choices.
Um,
Something on your finger that you don't want to be getting caught up in there. Rings,
Rings.
rings, jewelry going in there too. Right.
I mean, I can't cover that with my glove.
Some people aren't doing that way. So if you're going to have your glove on, what's going to happen if you've got your glove on and you don't know what you're doing yet and you're going to try to trim?
you won't be able to tell, and you'll cut off your ring, or
I'm
damage
going,
it.
you're thinking professional. I'm thinking, no, your glove's getting sucked up in there, your hand, it's ripping. You're going to freak out, and no. And see,
No
Amanda's
glove.
laughing because she's probably done that, because I've done that. And then your glove gets ripped, then you're freaking out, and then your fingernails start getting in there, and then you're not paying attention, then your finger goes and someone just needs to get turned off. So
You actually done this?
quiet, Amber.
I was just asking.
That's what happened to my experience at school and why we have to pay attention.
Oh no.
I haven't done that recently, but that was me and my partner's experience in school. And once you started laughing, then yeah, okay. I was 20. I am now 50. That's why we talk about professionalism.
Oh.
Trouble when that is in you act like that. Okay. Gingival displacement. That is good to know. So what did we talk about, what the purpose is of gingival displacement?
Expose like the margin.
It's a trough.
Yeah, we need to get access to, we need to expose that finish line. We might need to control the bleeding, what's the fancy word for controlling bleeding?
Hemostasis.
Yep, so that we can get access to that. So you know, hemostasis is causes the bleeding to stop. So we talked about finish line. What is the finish line? If we think back to that picture that it's been prepped, we've got this. Nope, that's not going to be a good analogy. We've got a line, we've got a trough going right around the whole tooth.
Your margin for your crown to fit.
So that's what does determine our margin. So it's going to go over that prepped part and meet up to the margin. We have an instrument that we have to put our retraction cord in. What's that called?
The cord bagger.
Right. Kind of got the word in it, so that's going to be a hint that it's called a cord bagger. That's in there. We had the question versus why a single cord and a double cord for our retraction cords. Be sure to elaborate on that. If not just a one cord is for one time and two is for two. If you would see a question regarding that, it would be that it's a deeper area, more bleeding control, so that you're going to have a couple, at least 2-3 sentences describing that. And let's see. You guys did well on listing reasons, listing clinical uses on why a retraction cord or why gingival displacement might be needed. See if you can remember some of those.
Why gingival displacement's needed?
Yep. Why are we doing it in first? When we're using it, what type of restoration would we use it for? Like we're not going to use it for
It-
cleaning. Yep,
A crown,
yep,
amalgam composites,
yep. If there was big ones and they're going in interproximally deep and we're going to be wanting to control that bleeding.
S5s or cementing crowns.
Yep. And
is that it?
one more. That's
Bridge,
good.
crown, amalgam composites, cementing crowns.
Eye trimming?
And it goes in with class 5 restorations and lower. I'm just gonna say it's root caries. So if you have to displace that tissue so that you can go in there and really see that.
Okay.
So crowns, amalgams, composites, cementing crowns,
Would be veneers.
or root caries, veneers. So almost everything.
Yep.
Okay.
Yep, pretty much. Okay, so units 6 and 7, was there any questions regarding that? Because that's fresh in the mind still.
I feel pretty confident about those ones. I really do appreciate the I know we're not supposed to call it a study guide, but the one we did in 6 together, that was like amazing. Just so you know, thank you so much.
Okay.
And the
thank you.
discussions too. The discussions I think really helped hammer some of that information in.
And go back and look in our chats too, because that chat does have quite a bit of information that Mizzy and I were giving out. I think for most of you is to spend time on units 1 and 2. 3 is going to start making more sense. Now that you actually got to do some of these procedures, it makes sense. It's going to make more sense too, and just go with your gut. Go with your first answer. The longer that you spend going back, forth, and second guessing yourself tends to be where students choose not the right answer. So I'm going to be in and out today, and I will be checking my email. And what do we have for time?
Are you, I'm sorry, are you gonna like write up a list so we don't all like call you and bombard you at the same time?
Yeah,
Like,
for you people here,
yes.
I have wrote down, I lost my notebook of names. I have too many piles here, guys. To go through exams that I can give 10 minutes to go through and do this as far as I can take. So I have Hyatt, Jenna, Jennifer, Nina, Amber, Olivia.
Okay.
Is that who I'm working with?
And Paige.
And Amanda.
Everyone.
Maria.
Paige, Amanda, Maria, Michaela.
What is this?
Amanda, where are you? You're like, you sound like you're underwater.
Oh, I have my headset in because
There you are.
I got 2 kids doing homework and dogs.
Yeah.
And
Oh no.
Okay, so I've got 1, 2, 3, 4, 5, 6, 7, 8, 9. And let's see if I can. Okay. This is the order that people have told me as well too, is Hyatt, Jenna, Jen H, Nina, Amber, Olivia, Paige, Amanda, and Maria. So you can, if you're not interested in this, then you can hang up. Is Hyatt, are you still on?
Yes.
Okay, Hyatt. Are you available in after I hang up here?
Yeah.
Okay, so I'm gonna give you guys my phone number. You can also text, and I can answer questions that way or guide you too. So 612-804-4311. So let's see. I will have Hyatt, then you can call, you call me when we're done. Jenna, are you gonna be available to go next?
Yeah.
Okay, because I have your number, and maybe it'll work better if I call you guys too.
Yeah, that might be better for you. So we're not all, yeah.
I am gonna have to take a break from like 11:30ish to 12 to get lunches at my son's school. So Jennifer, what number do you want to be called at?
You can reach me at 612-295-6087, and I'll be available all day except for 2 to 3.
Okay.
I have a meeting at 2 to 3.
Nina?
I just texted you my number.
Okay. Amber? You guys can text me your numbers or you can tell them to me. That's okay. I'll just need to hear from Amber, Olivia, Paige, Amanda, and Maria. And I'm just gonna go right down the line. And I'm probably gonna start with two. I'll probably do Hyatt and Jenna, and then I'll see what time it is. If Jennifer, if you're between 2 and 3, I'll skip over you and then come back to you.
All right.
Okay?
Yep.
All right. So, oh, I'm getting all your texts. So, okay, text me your numbers. And you better put your name in there with it too, since I don't have any of your numbers. Otherwise, I'm just going to call a number and say, who are you? And hopefully it's not a telemarketer or something like that. So, okay, I got to sign off.
All right. Thank you so much, Miss Hampson.
Yep.
Yeah, thank you.
Bye.
Thank you.
Bye.